I have quite a few veins here.
She's not alone.
And I see my sisters have it, my mother has it.
We're 2 to 3 times more likely to have them than men.
Age, race, doesn't matter. Brown skin can't even camouflage it.
It's less obvious than it is in somebody with a very fair complexion, but it certainly is visible.
They're mostly ugly, but they often hurt a lot.
And they show up on the calves, behind the knees, in the thighs, around the ankles.
And there's no escaping them for many. The spider veins are coming.
Why? Where do they come from?
They're tiny little vessels that just get filled with blood. They're all underneath the skin. There's no real good reason why they show up there, but they're there.
There are, however, some contributing factors to these creepy crawlers.
Some of it is genetic. If you have your mother's thighs, you might have her spider veins as well. Also pregnancy, any kind of hormonal fluctuations, weight changes, people who stand a lot without wearing support hose, and those who sit a lot, especially if they have their legs crossed.
Daisy Ataleros showed up after pregnancy. Pat Foster? Well, she's a nursing assistant, and even if she wasn't, she inherited her mama's spidey thighs.
It started in my late 30s. I'm now in my very early 50s, and they're really showing.
Pat chose plastic and reconstructive surgeon Emily Pollard.
So that's good.
So let me have you lay flat on your back.
Daisy went to vein and artery specialist Matthew Doherty to flush out those spiders and a painful mid-sized vein right behind her knee.
So this is what we call a reticular vein. So it's a little bigger than a spider, but smaller than a big varicose vein.
Both women are getting sclerotherapy, a mixture of medications injected directly into the vein, causing it to collapse and fade.
There we go. See that?
Wow. That vein just disappeared right before our eyes. How does it do that?
Well, what I'm doing is I'm flushing the blood out of the vessel using the medication, so it blanches.
You have to get it right into the vein.
Right into the vein.
What if you miss?
She can have a little bit of discomfort. I withdraw right away. She could develop a little scab there, but that heals up within days.
It takes only a few minutes and a few $100s. Still, she won't get them all erased today. There's a limit on how much medicine is injected at one time.
So maybe just 1 or 2 syringes would be the maximum amount that I would use in one session.
It's all one collection, but because veins have lots of connections and tributaries, you often have to get each one individually to prevent them from finding new pathways to come back and haunt you.
Same practice at Dr. Doherty's for the smaller spider veins, but he breaks out a foam for that one behind Daisy's knee.
And foaming it just allows us to use a lower dose to accomplish the same amount of vein closure.
Both Daisy and Pat now have to wear thick, tight support hose to keep pressure on the treated veins.
With sclerotherapy, I tell patients not to expect every single vein to go away first time, every time, but typically about 75 to 80% of what gets injected will regress.
I like it already.
It looks worse before it looks better, so in 6 weeks it should look very good.
And how about Pat? She did this on her lunch break.
I think they're looking better. This was not a bad procedure at all.